Ladies and gentlemen and colleagues, I'm happy to come here and do a presentation. This is based on my thesis on the development of Finnish child health centers, lastenneuvolat, and I will concentrate on the period before 1955. So it's the start of the Finnish childhood vaccination program. Now, why this is important? As we know, the anti-vaccination sentiment is growing in the Western world, and there have been several measles epidemics both in Europe and USA, and as well as in Finland there was a small one. And there's legislation in mandatory vaccination is tightened in several countries, like in France. I think at the moment 11 of the childhood vaccinations are mandatory at the moment in France. And the Finnish vaccination rates are still high among children. And what personally has been important for me is that Finland is also the promised land of vaccine trials. I was working as a physician at the Rota vaccine trial in the beginning of 2000, and there were no problem of getting children to be vaccinated. There have been several trials in Finland, and of course we have a very good infrastructure in child health care, and that's one of the big reasons why it is possible. Now, we had a new law on control of epidemic diseases in 2007 and 17, and after that, all vaccinations have become voluntary in Finland, also in military. But now there's an exception with healthcare and social sector, where several vaccines are still required, and there has been a big fight about COVID vaccine. And now, of course, we can ask. Is there anything to learn about the history of vaccination policies in Finland, and does it really explain the high vaccination rates? I will not go into COVID or any contemporary problems. I'm a historian, actually. I'm a medical doctor, but I'm a historian as well. Okay, I will talk a little bit of short history of vaccines, and especially about World War II, and then I will be talking about the popular attitudes towards vaccinations in 1950s, and then we can discuss. Now we have been talking about smallpox vaccination in Finland, and the last vaccinations were given in 1982 in Finland, but it was a big problem, and we had a huge smallpox epidemic in 1871, 1875, as well as in France, for instance, in Franco-Prussian War, and then the vaccination became compulsory. And here you can see what happened when a vaccination becomes compulsory in Finland. So it was a success story, but it was compulsory for children under 2 years, and the parents could be fined if the children were not vaccinated. And it was extremely unpopular because by 1920s the smallpox had vanished in Finland, and the vaccinations were still compulsory. So there was a great fight about the vaccination all the time. And here we have the list of vaccines developed before World War II. There's the rabies. We had a Pasteur clinic in Finland. It was started in 1916. Before that, the patients exposed to rabies went first to Paris and then to St. Petersburg Pasteur Institute. But there were some, like diphtheria vaccine and BCG was developed already before Second World War, but they were not applied in Finland because of many reasons, mostly conservatism and difficulties in starting. We didn't have any infrastructure for that. That's one But then the big turning point was World War II. After Winter War 1940, Finland received lots of international aid, and also we received a diphtheria vaccine from the state and from Canada, and it was really it was used then, but in Finland we used serum in diphtheria epidemics, and it gives about 2 weeks protection against infection, and there was a little bit of conservatism concerning the vaccine also among physicians, but then there was this huge pandemic starting in whole Europe in 1942, which was mostly caused by the spread by German troops who were invading Europe, and at the same time in Finland also the rate of diphtheria went up, infection rate, but it was probably a normal fluctuation in Finland, and it was not connected with the German troops that we had in Lapland. But and then we started in Finland, diphtheria vaccination started in mass scale, and the vaccines were bought from Germany, France, Hungary, Italy, wherever we could get them. It was a big difficulty to get these vaccines. And especially there was mass vaccination among military recruits, and gave access to it became possible to do some research on the side effects of vaccines, but the same thing happened with BCG. BCG was against tuberculosis. It was used already widely in Europe, but there were some problems. But it's a live attenuated vaccine, and that causes always problems if the vaccine is tainted. And in Lübeck, in the 1930s, there were several deaths in maternity units when newborn babies were vaccinated again with BCG that was contained live tuberculosis strains. So it's actually, I think it was forbidden in Finland to use it. So, but then more information was collected worldwide about BCG, and then the decision was made in 1941 to start using BCG, and we got it from Sweden, from Gothenburg, as a donation during the war and up till 50s, where Finland was a very poor country at the moment. And tuberculosis was a huge problem in Finland. And the same thing happened. We had these mass vaccinations starting among military recruits, and again information was obtained about side effects of the vaccine. So there's a new way of thinking during the war. So of course, wars and crises always cause changes in people's way of thinking, and this happened in Finland during the war, and it has actually happened anywhere else. I think that in Britain they also started with the diphtheria vaccination in 1941. They had also used serum before that. So these vaccines were very popular among the population, and they were voluntary. Nobody, I don't know about the military records, but otherwise, so they were voluntary. BCG was given especially to teenagers who were tuberculosis negative, and in some places also to newborns. But here we can see the vaccination numbers. So there was a large mass vaccination in 1943 and 1944 with diphtheria, and then in beginning of 1950s it evened out when we had started with the normal vaccination program in the child health centers. And with the BCG, the big mass vaccination it was in 1948 when actually all the youngsters who were tuberculosis negative were vaccinated in Finland. And of course then we started also to vaccinate newborns. And we got international aid from UNICEF and from in the international tuberculosis campaign. And you could see that tuberculosis was really a big problem in Finland. This is from 1934, the mortality per 100,000 persons. So it was, especially Finland, Poland, and Yugoslavia was badly affected. And France has always been, it has been said that there's lots of tuberculosis in France, but of course it was quite high, but not as high as in Finland. Then if we look at the incidence of pediatric respiratory TB in Helsinki, so you can see that it plummeted fast in 45, and the TB drugs arrived in Finland in 47, so this is something that happened before the drugs, of course, and its incidence. So it's probably due to the BCG vaccination, so it was very, very effective and also very popular. By the way, the BCG vaccinations were stopped in Finland in 2006, so we continued quite a long time. Here we have the diphtheria cases and diphtheria vaccinations. It was the epidemic was concentrated in the war years, and then it plummeted quite fast, probably due to vaccines, but of course there's the cyclical variation of the infection as well. Okay. Now there was a ongoing discussion about should the vaccinations be mandatory or voluntary, and actually it was only the smallpox that was mandatory and extremely unpopular, as I told. But here it was said that it should be mandatory, because the disease is so terrible and causes lots of death. And it says here that we should use the atom bomb of the vaccine to tackle the infection. And here we can also see that it's the bottle here is by Orion produced diphtheria vaccine. And but then there was a committee on vaccination policies, and it published its report in 1950. And they had been discussing this matter of mandatory voluntary vaccination, and came to the conclusion that vaccines should be voluntary, because the experience in wartime Finland had shown that voluntary immunization was possible. Of course, with a threatening epidemic, the vaccination could be mandatory. And one is a very important thing, that what vaccines should be free of charge, paid by the state, and which is crucial. They should be easily accessed. They should be connected to already existing institutions, child health clinics, schools, and the military. And education about the efficacy and about the vaccine should be given. And so the vaccination law came into force in 1952, and they all immunizations became voluntary. And now they were given in child health centers and schools. And what is special in Finland compared to many other countries, that's the practicalities of vaccinations were performed by public health nurses. And they had special permissions, but physicians were in charge of vaccinations. Actually, I can say that physicians nobody know nothing about vaccines in this country. It's unbelievable how ignorant they are, and actually they are the nurses who do all the practical things. We know about the theory of vaccines and so on, but now it's getting better with the COVID vaccines. We are all very educated at the moment. The smallpox had to be given mostly by a physician because of the logistics of vaccines. They were like vaccination sessions once a year. I was vaccinated when I was 8 years old by a physician. I remember it quite well. They were free of charge in public sector. When you got your vaccine in the health center or in school, but if you wanted to be vaccinated privately, which was quite common at the time, then you had to pay for it. And in 1952, the start of our vaccination program consisted of the BCG at birth and possible revaccination in school. Then we had this smallpox by 24 months, and then there was a diphtheria pertussis, whooping cough vaccine given 3 times between 3 and 6 months. And of course the regional differences were quite big at the moment, depending on the situation of the amount of public health nurses and so on. But 1957, the National Board of Health issued a letter that then unified the program in Finland, and then afterwards we can talk about national vaccination schedule. Now, the vaccination coverage was not very high in the beginning of 1950s, but it developed hand in hand with the coverage of child health centers. Now the maternal and neuvola and maternal and child health centers became mandatory in the communities. The law was written in 1943, and there was a 5 years interval by 1955, then actually all communities in Finland had these free of charge maternal and child health centers, which were run by midwives and public health nurses, and the doctor came there once in a while to check the women and the children, but mostly it was run by nurses, and it was very cheap. It's very low cost, and these nurses actually lived and worked in the community, and they were known and respected and trusted. Smallpox was very unpopular, and only about 50% of the children were vaccinated. But by 1960, the vaccination coverage was about 90% for the childhood vaccinations. And of course, new vaccines were added in the program, like polio was 1957. Polio had to be imported, and it was a inactive sulk vaccine, which was very expensive, and some of the polio vaccines were donated by a Swedish industrialist. So there was a lot of discussion about the polio vaccine as well. Tetanus also in 1957, which is quite late actually. Now, Now we come to the hesitancy question. Because the vaccinations were voluntary, it was very interesting to follow up and interview the population about vaccines and ask what they think about it. And the most interesting work is by Lea Liuksila in 1954. She was a sociologist and a public health nurse, and she, in her licentiate thesis, she interviewed several hundred families and asked about their opinions about healthcare and public health nurses, and also about vaccines. And most were had a positive attitude, but then there were these indifferent, and 10% was against vaccination. And these reasons for opposing vaccinations actually are much were interpreted mostly as ignorance that could be cured by correct information by public health nurses, like not believing in the effect of vaccine. You could show that it had been very effective against diphtheria, for instance. It was also, the low coverage was also interpreted as indolence of the parents. They just couldn't care less. But that could be cured in school, where the vaccination schedule could be completed, and of course when the parents weren't present in the schools anymore, but their children could be then vaccinated, and nobody really asked any questions. In child health centers, actually, I think that in the beginning, parents were asked that, do you consent that the children should be vaccinated? But actually, I don't think that they put any name on any paper, but it was thought that if the parents took their child to the child health center to be checked and so on, so the vaccination was part of the package. So actually, there wasn't so many questions asked. But it was okay. It usually went quite well. So these are quite funny, these comments on vaccines. Of course, if you are positive, it's good that you're vaccinated, and people died much more before vaccines and so on. But I think vaccines are good. Once I almost died, but when vaccinated, I was cured at once. So they really, the understanding what was a drug and what was a vaccine was really not clear at the moment. Probably, at the time, the person had got a penicillin injection. And then, of course, you have these indifferent or negative attitudes, turn healthy children ill, and then you put pus in the arm and the blood changes. That actually, I think it's probably like in smallpox. Actually, you get some pus in the arm, and then but maybe your blood doesn't change. And some thought that the child stops growing if he is vaccinated. They were like elderly people who had all these ideas, that negative ideas. Younger generation usually had a better, more positive attitude towards vaccines. And there's another one in, I think it was in Duodec in 1956, what kind of reasons there were reported why refusing childhood vaccinations. And this is, there's a fear again. 40% were afraid of the vaccines, that they would cause some damage to the child, and dislike. It's not nice to pick needles, to stab children with needles. Indolence, I don't care less. I couldn't care less, and only 7% of child's illness. So these are all attitudes that could be addressed somehow with information and good interaction with the parents and so on. The vaccine coverage in Finland, I will end soon, come to an end. This is I picked these numbers now just 2 days ago from the pages, internet pages of Finnish Institute for Health and Welfare. So actually the coverage is quite good at the moment. There has been lots of discussion about especially MMR vaccination. Because there are some pockets, regional pockets in Finland where there is some opposition against, especially measles vaccines. But it's the same area, Österbottnia, which had very low smallpox vaccination rates, and there was lots of active movement, anti-vaccine movement also in the beginning of 20th century. Now you can see that the old vaccines for tetanus, whooping cough, and so on have very high uptake, almost 100%, and the newest is varicella, 83%, and I think that varicella is not considered to be a very serious illness in Finland. We used to have these varicella parties, chickenpox parties when I was younger. You know, you took your child to a family which had chickenpox, and then your child got it. But I suppose that the number is beginning to rise. Now, if the totally unvaccinated children at 3 years is 1%. It doesn't sound very high, but actually it is. Now let's see. Now it's about 500, I think, children. Yeah, about 50,000 children are born every year, and then the school-aged children is about 0.7%. So it's not that high either. Okay, now I come to discussion. So what are the explanations for high immunization compliance in Finland? There's a typical, it has been in Finland, we have a trust in our institutions and our experts, which it's actually still quite high. It's not we trust our police and we trust our health centers reasonably well compared to many other countries. The situation it's not volatile, but it changes, of course. But I think that the COVID vaccination has gone quite well in Finland as well. Now, which Tim said, this is the accessibility is one of the most important things that we have had our system. It's been a good system. We had our centers, child health centers and schools where children are vaccinated, and it's very easy. There are many countries which have separate vaccination clinics. It's separated from the well child surveillance, and probably it's like in the States, I think that families pay for the vaccines as well. So our vaccination is always free of charge if it's part of the vaccination schedule. It's also for adults. If you want to have a tetanus shot in Finland, you go to health center, you don't have to pay anything for it. And one thing I found in my research, that there was really no coercive propaganda for vaccination or immunizations in the 50s, because it had to be more like more educational, because it was all voluntary, so you couldn't really push too hard the families too hard and force them to be vaccinated. And of course, there was in the 50s there was still familiarity with the diseases prevented by vaccine, but but which is sad that successful vaccination campaigns are always victims of their own success. First victim was smallpox, of course, but also today it's measles. I think that has been the victim of its own. Measles vaccination has been victim of its own disease or success, because I don't think that younger people know how severe measles is. It's forgotten totally. It's just some kind of a childhood flu or something. I remember I was 8 years old and I stayed in bed for 14 days when I had measles. I was terribly ill and so on. So I remember it. But I think I'll stop now, and if there's something you want to ask or comment.